Today, I'm going to talk to you about how the Affordable Health Care Act hurts our nation. Consider this quote: "When government has the power to control health care, the result is always rationing care by limiting access." The Affordable Health Care Act, also known as Obamacare, is promoted as a way to provide either free health care or low-cost health care to the masses of people in America. But the sobering reality is that under Obamacare, health insurance prices keep rising, not falling, and Americans will suffer the consequences in the long run. Today, I'm going to explain a few reasons why this new act does not benefit the majority of Americans and why it should not have been mandated in the United States. First of all, the Affordable Care Act will drastically decrease the quality of healthcare in America. It will make doctors and healthcare providers and facilities increasingly dependent on unreliable government reimbursement for medical services, which in turn will lessen the quality of care. It will add more people to the Medicaid and Medicare programs, as well as other assistance programs. 19.6 million Americans will be added to Medicaid, causing even more financial stress than we are already under. Lower payment rates from these programs will keep doctors from accepting these patients, even as more and more continue to enroll. This creates access issues for those who really need medical help. Overcrowding in hospitals and emergency centers with people who are taking advantage of this free system will be a big problem. This results in lower quality of care due to stressed and overworked doctors and nurses within the healthcare facilities. In turn, this causes problems of doctors quitting due to burnout. Studies already show that the majority of healthcare providers have negative feelings and opinions towards the Health Care Act, and these conditions will only worsen that. It also discourages younger generations from going into the medical field. America is projected to face a shortage of over 91,000 doctors by the year 2020, and studies show that the new Health Care Act is motivating current healthcare workers to retire sooner, leaving an even bigger gap in the number of healthcare workers needed and the number we have available. Another detriment of Obamacare is it tears apart doctor-patient relationships. Doctors will be treating so many patients that they will be unable to form relationships with individuals, which will result in a lower quality of care. Doctors who do have relationships with patients personally are better able to recognize changes and symptoms in them, which in turn leads to better care. Patients are more likely to discuss their health and well-being with doctors who they are comfortable with and who they know care about them personally. Another thing to consider: doctors will have to focus increasingly on government rules rather than the specific needs of their patients. This will in turn cause them stress and strain, and it will reflect in the care that they are able to provide. Another thing to consider: seniors and the older generation will suffer from detrimental cuts to Medicare. $716 billion will be cut from Medicare in the next 10 years, according to the Congressional Budget Office. These so-called savings will be used to fund other expansions mandated by Obamacare, but will leave our parents and grandparents without the coverage that they need and worked hard for. These lower rates will cause an estimated 15% of skilled nursing homes, nursing facilities, and home health agencies, as well as hospitals, to operate at a loss by the year 2019. This increases as the years go on. This means that these facilities have two choices. They can either cut back their services that they offer older generation, or they can close their doors, making it nearly impossible for our loved ones to get the care that they need. Obamacare is detrimental in that it inevitably raises prices for medicines and drugs that Americans need. Drug companies and medical device manufacturers will be heavily taxed, and an annual tax will be imposed on manufacturers and importers of branded goods. There's also a 2.3 excise tax on manufacturers of certain medical devices. This increase in these costs will cause us many problems. Either we will not receive the supplies that we need, or insurance will deny coverage for the brand name drugs that we use. Another disadvantage of the Affordable Care Act is that it removes financial incentives for Americans to maintain good health in order to financially save on high insurance premiums. Health insurance companies are no longer allowed to underwrite policies that are based on an individual's personal health. Premiums are the same for everyone across the board. This means that rates are the same for someone who takes great care of their body and stays in great shape to maintain their health, and someone who does not maintain good health. This can be seen as unfair to those who pay the same premium for services that they know that they are not likely to use, as opposed to someone using all services provided. There is no longer a financial incentive for Americans to pursue good health. Lastly, Obamacare violates our freedom of choice. In a time where consumers are increasingly demanding transparency, free choice, and the ability to shop around for competitive prices, Obamacare confides secrecy, mandatory compliance, and monopolistic practices. These are a few things for you to think about and consider when forming your own opinion on Obamacare. Thank you.